So lots of introduction there, but now let's really talk about what the final public charge regulation based on inadmissibility looks like. What's in it, and why are we as advocates concerned? So first, let me review the long-standing public charge test that's been in effect for decades, right? So the prior definition looked at whether or not that applicant for a green card would be likely to become primarily dependent on the government for subsistence. So again, to get their basic needs met, is that immigrant going to need government assistance? And for that definition, what is government assistance? And for many, many years, the only benefits that they would consider were cash assistance benefits like TANF, the state cash assistance for family, or SSI, supplemental security income for aged and disabled populations, and then general assistance, which is a cash assistance program through the township level of government. It also would consider Medicaid for long-term care expenses only. So that kind of long-term care institutionalization coverage from Medicaid, not regular Medicaid, but that long-term care piece. That was it. In addition, they would look at whether or not someone had a sponsor and if the sponsor's income was sufficient and there was an affidavit of support in place, they would consider that. So that kind of is here. So for the long-standing public charge test, it's always been forward-looking, and they've always looked at what's known as the totality of circumstances. They looked at just those two categories of benefits, and historically that affidavit of support that I mentioned has been more than sufficient to satisfy public charge. So if someone had that sponsor, they would count that, and public charge was just really not that much of an issue in the past. And so they would be asking the question, well, in the future, are they likely to need cash assistance or long-term care? And they always looked at the whole scenario. But again, as I mentioned, it's just, they looked at things differently. It was always the affidavit of support would kind of outweigh everything else about the person's case. And so I wanted to review that prior long-standing definition so that you see just how dramatically different the definition of public charge is today. And what many advocates and providers are aware of, and the community is aware of as well, is that now they've added some additional benefits to consider. So going beyond long-term care, Medicaid, and going beyond cash assistance. But I want you to finish this presentation with a greater understanding of the totality of circumstances, because more so than the benefits use, it's these weighted factors that they have identified now as part of the totality of circumstances test that will really make it harder for low or even moderate income immigrants to pass. So there's the definition, and then there's the test, right, when it comes to public charge. And the totality of circumstances is kind of that test. And when I say test, it's not like the person is taking a test or anything like that. It's more so, what is the immigration official assessing when it comes to their green card applications? So again, the prior definition, likely to become primarily dependent. Now you see this newer definition, which is honestly a little policy wonky, right? Receives one or more public benefit for more than 12 months in the aggregate within any 36-month period. What does that mean, right? And I don't want you to worry so much about this definition, because this definition is still future looking. It doesn't matter if the immigrant, is using these benefits today or has used them in the past several months, or especially doesn't matter if they use them before February 24th. The immigration officials are still looking to try to predict and figure out if they're going to need one or more public benefit for a time frame in the future. So yes, it is important, but again, that totality of circumstances test is really going to be the critical factor. And so when it comes to the benefits, we will talk about the benefits. The final public charge rule did add Medicaid with some important exceptions that I will review. It did add SNAP, or the food stamp program. It did also add some housing assistance programs, specifically the federally funded, kind of HUD-funded Section 8 housing choice vouchers, rental assistance, project-based housing, etc. And then cash assistance is still subject to it, and the long-term care is still subject because it's all part of Medicaid. So this has been a concern in the community. And it is important to understand that, only the programs that have been specifically identified in the rule, these benefit programs listed here, these are the only ones subject to public charge. So I'm going to take a few moments and actually just give you examples of benefits that are not subject to public charge. First, though, let's talk about those Medicaid exceptions. It's critical that people understand that there are many Medicaid programs that they can continue to use, or their families can continue to use, and the use of these Medicaid programs are not subject to public charge. So Medicaid for children through age 21, so that of course includes the All Kids program, as well as some Medicaid services, especially for students who are disabled and receiving benefits through school. EPSDT just is early periodic screening, diagnosis, and treatment. So it's a specific category of funding for youth. In addition, Medicaid for pregnant women. In Illinois, we know that as moms and babies, right? So the coverage for pregnant women, including for the 60 days postpartum that is federally funded, is excluded from public charge. And then emergency Medicaid for non-citizens. This is not a new program. It's been around for a long time, but this is a program where if an immigrant doesn't have a qualifying status to access Medicaid and they end up in a hospital emergency department due to a life-threatening or acute sudden onset type of illness or injury, this is a program to essentially get the hospitals reimbursed, is what it comes down to. I think a lot of us have become more aware of how important emergency Medicaid is due to the COVID-19 public health emergency. Our state, or Illinois HFS, is treating COVID-19 as an emergent health condition, and so immigrants can have their coverage, their health care for COVID covered by emergency Medicaid. So again, these Medicaid programs are not subject to public charge. Other programs that are not subject to public charge, many different types of assistance programs. We get a lot of questions about WIC, and it's concerning because people are canceling their WIC benefits because they're fearful of public charge. But WIC is not a benefit that is subject to public charge. And those of you who are familiar with WIC know that there is not a citizenship or immigration status requirement to access this program. Other local health programs, LIHEAP, our low-income heating energy assistance program. Some of the Part D subsidies that help pay for Part D prescription coverage, not subject to public charge. And you can see many of the other ones as well. Certain disaster relief programs are not subject to public charge. Head Start, Healthy Start, not subject to public charge. So before immigrants make decisions about especially canceling access to these benefits, we want to make sure they get some trusted information and guidance about this, because so many are not subject to public charge. This slide lists the many services provided within the school setting that are excluded from public charge. So a few important ones to highlight, if someone has an individual education plan or an IEP and services associated with that, not subject to public charge. The free and reduced school lunch program, also not subject to public charge. And the pandemic EBT program, which was provided last school year and is coming for this current school year, though the state is still waiting on guidance from the feds around this. But pandemic EBT really designed to replace the meals that students lost access to because the schools were closed during COVID, really meant for those folks who are eligible for free and reduced school lunches. So you can see many school services not subject to public charge. So to kind of summarize the use of benefits, which I know many immigrant families have questions and concerns about, but please know, only the programs listed in the rule are subject to public charge. That's why I felt it was important to list so many examples of what is not subject. Also, people may have questions about past use of benefits. We can reassure them the new rule is not retroactive. So if they used benefits prior to February 24th, the USCIS officials cannot look at that past use of benefits. Often what you see with mixed status households, though, and the use of benefits is that it's not the immigrant who is seeking a green card who's getting the benefits, right? In fact, I think I'm going to mention in a moment that for the most part, people who are seeking their green card, they're not eligible for these benefits anyway, due to the strict rules around eligibility and immigration status. But they may have eligible family members, right? And so please reassure them that the use of benefits by their family members will not count against their green card application. So we've got an example on this slide, and we often see this in mixed status households, right? You might have an undocumented parent who has a citizen child, and the citizen child is eligible for SNAP and is eligible for Medicaid, certainly, and other benefits, but the parent is not receiving benefits. It's just for the child. That child's use of benefits will not count against the parent if that parent has a pathway to a green card. I mentioned this just a moment ago, but when we think about who is applying for the green card, these are folks who typically do not have a qualifying immigration status to access these benefits. So for the most part, to be able to qualify for the benefits that are subject to public charge, a person typically has to be an LPR for at least 5 years or longer, right? So, that means someone already has their green card. So they're not getting benefits before they have their green card. The other qualifying immigration status category are those humanitarian statuses. So immigrants who are refugees or asylees or have some other qualifying humanitarian status, they are also eligible for benefits. But remember, these folks who have these humanitarian statuses, they're not subject to public charge. So I know there are lots of questions and people get very concerned about, the use of benefits, but it's not so much about that current use of benefits. Again, USCIS is looking to the future.